Our next speaker, Don Ludwig, is a parent of a 16-year-old daughter, Joy, who I think has just arrived. Hello. And has received services from DMH for several years. I'm going to keep my introduction brief because Don and Joy have a remarkable story to tell us, and I'm grateful to you for sharing it. Don?
So I'm Don Ludwig, this is my daughter Joy, and our story is one that wouldn't be a success without DMH. And it started out when Joy was about, maybe 11. She started cutting. Started seeing signs of trouble. She tried to commit suicide for the first time a month after she turned 13. She was in Texas at the time, and Texas doesn't have a lot of social services. She was in the hospital for a few days. They let her out. Not much else to do. DCF wasn't responsive. Fortunately, we got to Massachusetts and have been living here, and were able to turn the road in a different direction. After we were here, Joy was doing okay for a while. We got her involved in a program at McLean through the McLean 3 East, a dialectical behavior therapy program. It was a day program. She went for a couple of weeks. It was a month-long program. She did well. And then she started to go downhill again. The cutting got worse. Added eating disorder behaviors in there. She was diagnosed with PTSD, depression. We couldn't really figure out all of the details of what was happening. Toward the end of that program, they realized that she needed more help. And as they were discharging her, McLean basically said, she needs more help, and we can't give it to her. We're not set up for the eating disorder behaviors. We're not set up for some of the self-harm behaviors. Yes, we can handle that, but she really needs more, so we're going to discharge you. So I took my little girl home, and fortunately, the DBT therapy gave her enough consciousness to say, finally, Mom, I need more help. And when we called, they said, well, the best you can do is take her to the ER. So we ended up in the ER and ended up waiting for a bed in the hospital for almost a week. They just admitted us. They didn't know what to do with us.
And they put us on the surgical floor with a one-to-one because they had no room on the psychiatric floor.
So we were kind of stuck. They finally found her a bed at Franciscan's, and when we went to Franciscan's, finally Joy was in a locked place that was safe, and it came out that a lot of the PTSD and other things were stemming from sexual abuse from her biological father. She was finally in a safe enough place to start talking about what had happened. So we kept her safe, and as we were in Franciscan's much longer than they would normally, kind of usually 2 weeks, we were there for about 5 weeks in Franciscan's, and they finally said, why don't you get DMH involved? They might be able to help. So that's where our journey with DMH started, and I have to say that when they stepped in, it made all the difference. They started getting to know us. She ended up staying in Franciscan's for about 5 weeks, and then in CBAT, their step-down program, for about 6.5 more weeks. We really stretched insurance. Fortunately, we do have good insurance, but we stretched them as far as we could. Brought her home. She seemed to be doing well. Again, DMH stepped in. They connected us with resources, and that's what really is so important. They didn't do everything for us. They connected us with the places that we needed and the resources that we needed in order to get the help that we needed. So they connected us with the Home for Little Wanderers Collaborative. They came to our house once a week. They helped us as a family, and we realized that the mental health is a family issue too. The parents, we have our own trauma watching our children And one of the things that we got from the collaborative was parent meetings. I started going, Joy's grandma who lives with us started going as well. We were in a group of totally different people, every ethnicity, socioeconomic status, it didn't matter. We were there for our kids and we understood each other and we supported each other, and I learned a lot about how to support my child. As we started going through, she was looking better and better. There was a period of time where the cutting got worse. We put her back into some programs, of which she talked herself out of the programs before they drug tested her. And so she, you know, 2 days here, 2 days there, but our caseworker kept coming in and saying, I know she looks like she's doing well, but let's keep looking, let's keep on track. And we kept looking, and we were just about to start thinking about lowering services. And about that time, we took a family vacation, everything was looking well. About that time, Joy started having some really strange behaviors that I didn't quite understand. And one day she went missing. And when I called her on the phone and I said, where are you? And she said, I'm at the library. And I said, I'm standing in the library and you're not here. Where are you? And what are you on because you're slurring? Turns out she had been on a run where she'd been doing a lot of drugs. She'd been keeping the presentation up so no one knew. She basically ran off, and when I Googled her friend's phone number, I found pictures of my kid who had been talked into prostitution for drugs. She was gone. She was on, I don't know, a couple of Perk 30s and some vodka as I was talking to her. I'll be home later. I couldn't find her. When the police finally showed up and they said, who's her dentist? I thought my kid's gonna be dead in a ditch. She was on drugs. She was selling her body to get them. And I didn't think we'd ever get her back. Finally at 11 p.m., the police called me and said, we found her. She's face down, she's drugged. I said, meet me at Children's, and we went to the ER again. She woke up the next morning going, how did I get here? And when can I go back home? We realized drug addiction was another piece, in addition to all of the other things. And they sent us to another program. They got us back at McLean, and insurance said we had 2 weeks. And then we were on our own again. And fortunately, DMH stepped in, and our caseworker, Judy, said she needs more help. We stretched insurance as far as we could. She was there 6.5 weeks. And what Judy said was she needs a higher level of care. She needs to go into an intensive residential treatment program where we can address her drug issues, and we can address her eating disorder behaviors, and we can keep her safe. And we can help get to the bottom of the trauma. Because if we don't get to the bottom of this, she's going to end up in the ER over and over again. She's going to end up homeless, dead on the street, into prostitution, who knows what, drugs. And basically McLean said, it's never been done. You're going to step up, you can't do that. And my caseworker at DMH said, that's what this kid needs. And they did it. 2 days before she was transferred, my insurance cut me off. Luckily, I got to appeal, and they gave me 2 days to appeal. They moved her to Cohannet, an intensive residential treatment program, and Joy started getting the help that she needs. That was over 1.5 years ago, and 6 months ago, she graduated from that program. actually dedicated to her sobriety, started going to NA meetings, and all along, our caseworker at DMH was the one linchpin that held us together. And when she was ready to step down, we said, what's next? And the first person we went to was Judy. And we started looking for other schools. We got her in a step-down program at the Vanderhoek Center at Glen Haven, coordinated with the Justice Resource Institute, and got her involved with My Life, My Choice, who helps women who have been in the business get out. And she had a mentor. She was working with her, got her off drugs, and was at Glen Haven for a while. She was doing really well. They finally stepped her down to a kind of in-between residential and independent living, a house at Glen Haven. And now she's saying she wants to be home again and finish school and go to Harvard and be a prosecuting attorney. Maybe one day she'll be at the State House here. And she's also 10 months sober.
Three years ago, I didn't think I would make it to my 16th birthday, and now I have plans for the future. I never thought I would get along with my mom, my stepdad. I never thought I'd be able to be there for my little brother, and DMH gave that back to me. They gave me back my life. And Judy stuck by my side. I was rude, I was hostile. Mean does not even begin to cover how I treated her. And she still fought for me, and she still came to see me, and she put up with it. And I have so much gratitude for her and for DMH and for the state of Massachusetts, because they saved my life and they saved my family. So thank you.